strategic plan.
Right, I forgot to start that.
That's okay. And so earlier this year in April, we released an update to that report, and it updated all the data, but it did not look at the impact COVID had on our community. So that gave us the great opportunity to hold listening sessions again, to revisit with our stakeholders and find out how COVID had impacted them, and also to make sure that we were still in alignment with our advocacy and strategic priorities. So over the month of June, we held 10 listening sessions, multiple interviews, and did some surveys. We talked to over 120 stakeholders, including those with lived experience, and they represented about 60 different organizations across our community. We took all the feedback from these sessions, and in order to make sure that we would take these and really use this in our work, we organized them in the framework of our 5 priority areas, and they're up here where you can see them. Just to remind you what they are. We increase exits from homelessness, reduce barriers to exiting homelessness, support public transit, impact policymaking, and strengthen coordinated community response. So I don't have time to go through all that we learned, but I'm going to give you a few of the key takeaways in the framework of our priorities. The first one I want to talk about is one that was talked about in every single listening session we had. It was talked about in terms of those experiencing homelessness and the staff of the organization serving those experiencing homelessness. And that was the concern about the increased need for mental health services and just the stress, the strain that people are feeling in our community. One of the participants we talked to at Trying Mercy Center, who's currently living unsheltered, shared that during COVID, he experienced setbacks mentally, physically, and economically, and that he lost 5 friends in the course of a year and a half. He shared that with us also in the context of saying he was seeking more help mentally with mental health, which I thought was beautiful. It shows he's advocating for himself, that he knows he needs it and he's going after it. But he's not the only one we heard from. We heard people who are in frontline service providers say everything happened to everyone at once. We were all affected in some way. It did not discriminate. And one nurse practitioner shared that it's the worst burnout of her career. There were a lot of contributing factors that were brought to that were discussed: isolation, separation from support systems, increased stress in terms of staffing shortages. It's been exacerbated by the slow return of volunteers to some frontline service organizations. And we even saw in some research we did that Philanthropy Today said that as of December 2021, that nearly half of nonprofits across the country had 20% or more of their positions open. It was causing them either to reduce service to clients or not take in new clients at all. There was also been one session with Prisma Health, a participant who shared very vulnerably that she fought the anxiety of being afraid that it was going to happen again. So fear is also another piece that we saw. The next area that I want to discuss, which also came up in every single listening session we had, is the need for more affordable housing for those that we serve. It was very interesting too. A lot of the discussions centered around the fact that housing and health are so intrinsically connected. Because how can you ask someone to shelter in place to protect themselves from the virus when they don't have shelter, right? So we did see that it brought some light to the issue of homelessness, which was very good, very important. This area was not only talked about in terms of those experiencing homelessness, but again, also the staff in organizations that are serving those experiencing homelessness who are also feeling pressure. One of our participants talked about the fact that while the moratorium was really good for renters during the pandemic, that it put pressure as it was lifted on renters to get back in the game of paying their rent, and also on landlords who were not able to keep their properties afloat during the pandemic who then were forced to sell to investors. And that in turn typically will turn a unit to a market rate unit instead of a lower income unit. And there's another unit out of the inventory for us, for those that need it. So, all right, next, we're going to look at both impact policy making and strengthening community response with these, because this is talking about advocacy and collaboration. This was an area where we had more positive comments, which was really great. People saw lots of collaboration. They saw lots of things happen, that a lot of innovation that happened in organizations that had to start doing things differently and found ways to do it better. But in this area, we ask for our listening sessions participants to look at the advocacy agenda we have and to confirm for us, are we on the right track? What are the most important things to you? And these are the things they said: reducing barriers to housing, like eviction. They said to create opportunities for previously incarcerated residents, especially in the area of housing and workforce, to expand affordable childcare options that are accessible to parents experiencing homelessness or seeking to exit from emergency shelters, and to support full funding of Green Link's transit development plan through 2023. So, what can we do with what we just heard? Well, the first thing that we can do is you can take this little QR code on the slip of paper that's at your sheet, and you can go read the brief. Go see what your colleagues are saying. Go see what we learned and talk about it and share it. Because if we're going to change homelessness, then we have to change the system that holds homelessness in place. And one of the most important parts of that is, and that's what this graph is, it's all the conditions that hold a system in place. And the one that's critical is the one at the bottom, the mental models. It's how people think and feel. So until we start helping people see the truth about homelessness and the truth about the barriers we're facing and the truth about the things that need to change, we are not going to see change. That's the first thing you can do. What we will do is make sure this information gets to our working groups and to our steering committee so that it gets integrated into the work that we're doing. And finally, if you really want to roll up your sleeves and get involved, then come and join one of our working groups. They're doing amazing work. They're bringing our work to life. So if you're interested, please reach out to me and I'll be happy to connect you. Again, I want to thank everybody who was a part of this process, who spent time and energy. The Greenville Homeless Alliance is us. It's an alliance. It's us working together to create something special, to create change, to ignite change and change the system. So thank you again for being a part of this, and thank you for being a part of the Greenville Homeless Alliance. And now I will invite Lorraine to come up.
Well, Heather, thank you for the introduction. Let me see, where's the clicker?
Oh,
Are you doing it for me?
No,
No,
I'm sorry. If you'll
We
just,
don't have a
you can
clicker,
either
but
just use the mouse.
Oh, I'm left-handed.
Oh.
I'm just gonna mess everybody up
That's
here.
okay. Do you want to
I'm
just
going left-handed.
You want to use the
I'm not gonna use the arrows, can I?
use the arrows? Yeah,
Okay.
that'll be perfect.
Perfect. All right, here we go. All right. For those of you who don't know me, my name is Lorraine Crowell. I'm the CEO at United Housing Connections. I chair the Upstate Continuum of Care, and I serve as the vice president of the South Carolina Interagency Council on Homelessness. And so in a lot of different levels, a lot of different conversations, saying exactly what we just heard from Heather, is that housing, mental health, physical health, all of those things are just absolutely intertwined and must be considered as we talk about how we're going to create a system to end homelessness. And, you know, and when we talk about systems of change, we talk about, you know, connecting the dots from this place to this place to this place. And frankly, that's what the CoC has not done well. That's what our community has not done well. And it is going to be critical for us moving forward to connect all of those dots together and make sure that we're bringing in all those important aspects of partnership to end homelessness. So I thank you for your time today. We're going to talk a little bit about leveraging public funds and how we sort of work together to distribute some of the wildly heavy funding that many of us received at the same time. The CoCs were charged with federal and state funding to administer that in some way or regard. So it was a heavy lift for us. We went from 18 employees in early 2020 to 44 employees today, just to handle those funds and just to handle the volume of people who were needing services. So let's talk about that for a minute. Early on, we went to our service providers and said, what is the most important thing that you're going to need going forward so that we can request those funds from our state and federal officials? And by overwhelming majority, our shelters said, we need a quarantine shelter. We don't have capacity to create two separate places and serve two separate groups of people. And so we went about applying with the Department of Admin, Office of Economic Opportunity, through their Emergency Solutions Grant to get about $1.7 million. I think 1.725, something like that, to develop a quarantine shelter. And that was, again, one of our very first really terrific opportunities for collaboration. Miracle Hill staffed the guest services portion, as well as United Ministries came on board and helped us staff it. Greenville County provided startup funds of $157,000. We also ran the facilities and logistics. We're pretty good at running facilities. We have about 450 units, some multifamily as well as single family. So logistics is our field, but service delivery in mental health services and behavioral health is not our strong suit when it comes to housing services. So thanks to all those partners. The Phoenix Center provided the space at the Shipman Center. It's been a godsend to our organizations as well as this effort. Prisma provided all of the help services, including a physician on call all the time and home health services. Greater Greenville Mental Health provided support to our guest services who needed mental health support. Grateful to them. And to date, the shelter has served 205 guests, saving the hospital system 1,435 nights of bed service. So it was a great opportunity for us to support the community as well as our folks experiencing homelessness with COVID. This is the breakdown. I'm not sure how well you can see it from where you are, but we did serve folks from all over the upstate. If someone called and we could logistically serve them and get them to the shelter, we would do so. And so at this period at the end of March of 22, we served a few more since then, but 184 guests, 1,281 days in-house service. Then we started talking together as a group about, everyone, United Way, all of the service providers, the housing authority, everyone that is our normal go-to partners all came together and said, okay, we've got emergency rental assistance coming here and it's coming in a big way. So what are we going to do? How are we going to work together? And so we came together under a program that the Greenville Housing Fund sort of initiated called Rethinking Homelessness. And so we literally came together as service providers and funders and said, okay, how are we going to utilize these funds? So, and that was the Emergency Rental Assistance 2 funds. But as we talk about all the work that the CoC has done since March of 2020, through all of these sources that you see on the screen, we're now at about $8.2 million in distribution of rental and utilities assistance and shelter services. So it's amazing that when we look at a number like that we've been able to do that over that period of time. And, we're not the only ones. There were service partners share and all of the shelters, many people who were also getting funding in abundance and trying to get it out the door. And so we're grateful to everyone who was on that charge. And this is just something I wanted to share with you guys. We have something called the coordinated entry system. And so what we do is we utilize a system, a vulnerability index, to evaluate people who call and need housing and are experiencing literal homelessness. And so through that system, we try to evaluate who are the most vulnerable in our community. And so this was a report, and this is just through April, January through April. But this sort of tells you the number of people. Now, this does not at all represent the number of people in our community who are experiencing homelessness, not at all. These are just the people that we've been able to support in our program only through the coordinated entry system. But we're talking about, in our system, we have 43 individuals. Well, in April, we have now over 450. But the majority of what I want you to see is the lion's share are in Greenville County. And so we have a big job. I would triple or quadruple that number of people who are really out there experiencing homelessness. So just wanted to share that with you guys. Thank you for the opportunity to serve this community. The CoC and UHC are humbled and pleased to do that work.
Good afternoon.
Good afternoon.
My name is David Samloff, and I am the director of the Housing Choice Voucher Program at the Greenville Housing Authority.
I'm just going to put your name up there.
Okay, there we go. Housing Choice Vouchers are what used to be known as Section 8. HUD changed the name probably about 10, 15 years ago to better serve the clientele and to remove some of the stigma that was associated with the term Section 8. But what I'm here today to talk to you about is several of the programs that we're running at the Housing Authority. One you've all probably heard about are the emergency housing vouchers. Back last year in May, the HUD came out with a program to provide housing authorities with additional vouchers that were tied to emergency housing, and they gave us some special things. They gave us some extra money so we could create some incentives for landlords to participate in the program. Additional money to assist those people who are referred to us for down payments, security deposits, application fees, and things like that. The program also allowed these families to jump our wait list. They weren't involved in the wait list, but what they did require is referrals from the continuum of care. So Lorraine and her crew and the Housing Authority have been working very diligently to get the 54 vouchers that we were allotted filled. And I can say today that we have 53 of those 54 fully leased up, which is great. It's taken a year. It's taken a lot of effort on the part of the CoC, the providers that referred these families to the CoC. The program is there to assist families that are homeless, potentially homeless, running from domestic violence, coming out of our jail systems, human trafficking, and those types of things. So we really appreciate all the help that we've gotten. We have one more voucher. Unfortunately, it's not available. We're just waiting for a final on an inspection. And so, as they say, what is it? The Voice, my team is full. Okay. So any new referrals would end up having to go onto a wait list, unfortunately, because we are full on that program. Just to give you some numbers, we are, well, now that we're 100%, we're tied with Columbia as far as having all our vouchers issued and leased up. We are very near the top. We're probably in the top 5-10% of all the agencies throughout the country as far as getting our vouchers leased up. HUD issued 70,000 of them. So I'm very proud of my team. We have spent almost $18,000 on helping people with security deposits, those 54 families. We've paid landlords incentives of almost $13,000. And I'll talk a little bit more about incentives because I'm going to talk about moving to work and what that means to us and to the community. The other program I wanted to talk about briefly is homeless vouchers. Back several years ago, our board decided to set aside 60 vouchers for a homeless program. Now, these vouchers are, again, would bypass our regular wait list, and they come with referrals from the continuum of care and through UHC. And one of the things that they do require is they require ongoing case management. So right now today, out of those 60 vouchers, 50 of them are set aside for homeless individuals or families. We have 35 of those leased up, and the other 10 vouchers are a program called New Lease on Life, and those are for families with school-age children where the children at least are homeless. We have 5 of those leased up. Right now, the Housing Authority and UHC are in the process of reworking the MOU between us because one of the biggest problems we found, and through COVID, and you as providers will know, ongoing maintenance of for families, case management in this program is supposed to be continuous. And so that could be a week, a year, 2 years, 5 years. And it's very difficult for all of you to provide that sort of case management right up front. So we're reworking that program. We do right now have four families out there searching for homes that are under that program. So we're going to, again, start looking at that program in replacement of the emergency housing vouchers for those families that are experiencing homelessness. When I talk about wait lists, just about every program that we have other than those require a family to be on a wait list. Last year, we exhausted our wait list and reopened. We were open for 2 days and we received a little over 3,000 applications, which is, excuse me, absolutely huge for just 2 days. And we did some things a little bit differently this time. We created some preferences. One is a homeless preference, and one is a live or work in our jurisdiction, the city of Greenville or Greenville County. And so we've begun to pull from that list. One of the hardest things we found is getting families to understand the HUD definition of homeless. So, and if we pull someone who says that they are homeless and they don't qualify, they're not removed from the wait list, they're put back on the wait list, but without that preference. And we'll work down through the wait list for and pull those families as they come up in order. But we are pulling from that list. Okay. Last thing I wanted to talk about is moving to work. What is moving to work? Basically, the Housing Authority is required to follow specific HUD guidelines, rules, and regulations. The books are thick and they're very, very detailed. Moving to work allows us to make changes to those rules and regulations and create programs that are locally oriented, but all approved by HUD. And what we've done is we were lucky to be selected out of, I think 39 of us were selected for this group of moving to work, and it's called Landlord Incentives. So we're in the process of writing our MTW plan, but there are a couple of things that we found that work very well with the emergency housing vouchers. And what those were were things like incentives to the landlords. On emergency housing vouchers, if you're a brand new landlord, never been with us before, you get $1,000. If you lease up somebody and you have been a landlord, we're going to give you $500 straight to your bottom line. So that's worked well. We're looking at in the emergency housing voucher and in the move to work, we're looking at doing pre-inspections. So units are inspected, which is a requirement of HUD, prior to somebody even finding that unit. We're looking at vacancy losses. So as a potential thing that we're going to do. So if a landlord's unit is vacated, we can potentially pay them for that vacancy until they fill it with another person with a housing choice voucher. We're looking at damage claims where a tenant moves out, damages the unit, and it's beyond their security deposit. We can pay a certain amount to be determined, as long as the landlord puts someone else with a housing choice voucher back into the unit. So there are a lot of exciting things that are happening at the Housing Authority. We expect to get our plan completed in the next month or so and get that submitted to HUD and go on from there. But so there are a lot of great things happening at the Housing Authority. We're here to help and to serve where we can. Just because our emergency housing vouchers are full right now, we've been lucky. We've had one family that has left the program. So there is potential for others. And there is, of course, the homeless program that we're reworking, but we'd love to fill those vouchers and get those families in decent, safe, and affordable housing. Okay. I left my list of who's next.
Shauna.
Lashana? Ashana is next. There you are. All right. Thank you.
Hello, everyone. Can you guys hear me?
Yes.
My name is Ashana Taylor. I'm with NHE. I am the development coordinator at NHE. And NHE is a locally owned property management company across the Southeast. We manage both market rate, single family homes, as well as affordable homes. I'm also a member of the Innovate Working Group and standing in today for Adric Caesar, who is leading the subgroup focused on engaging the faith community on behalf of the Greenville Homeless Alliance. Adric, in addition to working full-time for Elite Integrated Therapy, founded and runs the Good Shepherd's House, which is a shared housing model. He is helping a man today who was previously experiencing homelessness in Pickens County. And the way that he's helping him today is that this tenant of his currently does not have transportation. So Adric was nice enough to accompany him to court today so that he could avoid an issue for his arrest. And the reason for me sharing this with you all today is to highlight the additional layers and barriers people continue to face as they work towards thriving in all areas of their life after exiting homelessness. Our subgroup focused efforts in 2022 to engage with the Greenville County's faith community. Thanks to GHA's intern, Jason, we have identified nearly 700 places of worship in close proximity to the 86 Greenville County schools reporting one or more students experiencing homelessness. 700. As a graduate of Greenville High, it shocked me to learn that the number has been continuing to rise over the last 10 years. And unfortunately, is predicted to continue as Greenville County grows. During the 2021-2022 school year, the number of Greenville County school students experiencing homelessness increased to 1,304. Our subgroup selected biblical justice as the basis for creating a forum where pastors and lay leaders can come together. We have discussed this as a part of GHA and the collective community engaged in the work that we are ambassadors of hope. Our hope comes from the endurance and encouragement from the word of God. We must first receive hope in order to give hope. Will you join us in being ambassadors of hope? Here's what we want you to know so that you can help us reach more of the leadership of the 700. NHE is hosting an opportunity on September 5th from 6 p.m. to 7:30 p.m. with dinner included. Pastors or leaders who will attend will hear from the panel of local pastors who are leading the efforts to address homelessness or related issues such as people who have been previously incarcerated, experiencing housing insecurities, and community development. Following this panel discussion, everyone present will have the opportunity to ask questions, share what they are also doing, and discuss our collective work together. For those who want to learn more about development opportunities regarding their congregation land, they will be invited to the session in October led by Community Works, who is bringing an expert to share on the topics of fundamentals of faith-based development, sustaining the church, creating additional revenue, streams beyond the tithe, and financing packaging, which is the art and science of working with lenders. Tammy Hoy Hawkins, who is here today, is leading the other subgroup for Innovate, and we thank her for linking the session to GHAs. At your seats, you will all see that you have a paper that asks you to, if your church is interested in helping us in our efforts with the research and identifying other resources within the faith-based community, we ask that you add your church information, and thank you.
You said September 5th, but the paper says September 15th.
Sorry, September 15th.
Good afternoon. It is wonderful to see some familiar faces and friends I haven't met yet. My name is James Campbell, and I'm the coordinator for Wellbeing Partnership. I've been doing work around Greenville County for about 25 years. That means I've been in this a little over a quarter of a century. And I would be in it longer, but I didn't get started younger, so it's the best I can do. I'm here today in my role as Wellbeing Partnership Coordinator. Some of you may have heard of Wellbeing Partnership, some may not have. Wellbeing Partnership was formerly known as Greenville County Behavioral Health Coalition. A while back, we began taking a look at how we could be a little bit more intentional and effective in terms of the work that we hope to achieve in Greenville County. So what we really began to do is, number one, get clear on our vision. And our vision is optimal mental health and well-being for all Greenville County residents. What does all mean? All means all, regardless of what zip code, what area, what demographic, what anything. We want to make sure that there's a level playing field and even access for all behavioral health services, whether that be mental health or substance use related. We seek to do that by advancing cultural, community, and clinical change to improve mental health and emotional well-being. And all of that sounds really lofty. So let me break that down a little bit into functionally how we do that. We have 3 working committees that really work in tandem to try to work toward those goals. First is data. The reason we start with data is because it's really easy to jump in and want to do something that's already being done, create a redundant service, not meet a need that's felt in the community. So we wanted to be really intentional in finding out where are the gaps that anecdotally we knew where some of those were. But as we dig down into the data a little bit further, we can get a better sense of where are the needs in our community? What are the things that we can help be a part of addressing and meeting? As we become aware of those, what we then do is work with our Solutions and Innovations Committee. And with them, we try to do exactly what it says. We try to figure out how could we more effectively fill in these gaps? What needs can we meet? What are the partners we don't yet know about? What are the services in Greenville County we're not familiar with that we could potentially refer to? How can we really support each other in the work that we're all seeking to collectively do? And then third is advocacy and policy. And so in that regard, when we do see the need, we have an idea for a solution or a way we could come together with other partners to meet a need. How do we then begin to advocate for bringing that into reality? From that point, it circles back around full circle to data so we can see if what we're doing is actually making a difference. Is it moving the needle any? Is it having any collective impact? Any impact toward what? What we're trying to target are the outcomes that are listed over to the right. I think these are probably well aligned with most of the goals and initiatives of folks in this room as well, to increase collaboration. What I find is that in this profession, oftentimes we look a lot more like the ills and illnesses we seek to treat than the recovery that we try to inspire. We get together in our little silos and we do great work, but we don't always know what each other is doing. So what if collectively we came together to do some troubleshooting, collaborating, and problem solving so that we could be more effective? And when there are initiatives that need support, the more collective voice we have, the greater influence we'll have in terms of whether it's a political solution, a piece of legislation that needs some support, or pointing out issues that maybe haven't been considered as we move forward. That also includes improved community support services, coming alongside shoring up the services that already exist. I know one of the things that's been mentioned already is the struggle in keeping programs fully staffed. I know very few behavioral health services of any kind in Greenville County that is currently experiencing being fully staffed. It's almost mythological at this point. And so we're trying to work on some things around workforce development as well. Decreasing stigma is huge. What we know is that 9 out of 10 people who could benefit from behavioral health services never walk through the door of any behavioral health service. My goal isn't to get them all through the door of a behavioral health service. Our goal is to get them support. That support may be through mutual aid programs. It may be in the community. It may be within the faith community. Whether or not they get through formal support is of less interest than that they get the support that they need to be successful. And that's a community and collaborative effort. Improve perceived mental health and resilience, that people identify as getting better, that they are sometimes the best judge of that. And if there are places where their perception and what we perceive aren't the same, to have that conversation to see how we can get greater clarity on that. Improved academic achievement. So we work with the school district as well, as was mentioned, the number of homeless students. That is a factor that is certainly alive and well and that we take into consideration as well. And decrease suicide attempts and suicides and overdose deaths. We know that deaths of despair have been significant during this period of time, in particular of COVID. So how can we seek to impact that and provide greater support to making sure that people who are at that critical point have people they can reach out to, that they know who to call or how to follow up or how to reach out, or if it's a family member, who that person can reach out to as well. So a few initiatives that we have that are kind of working toward that end. The work of the committees is ongoing that I mentioned previously. Continuing to build community partnerships. I mentioned that there are a lot of folks in here whose faces I know, and there's a lot of people that I've met already today whose organizations are part of Wellbeing Partnership. As it stands today, we have 57 partner organizations. And if yours is not one, we would love to change that. It's not so we can say we're at 58. It's because collectively we can make a greater difference than we can individually. And we really want to work cooperatively together toward that end. One example of that that's tangible is the coming together at the Lottie Bill Gibson Center. That's over on Industrial Drive off Lawrence Road. Some of you are familiar with that. But what that did is effectively brought 3 organizations under one roof with Mental Health America, NAMI, and the Phoenix Center's detox program upstairs. That's economies of scale. That's people being able to work together collectively across agencies to meet needs and to be more of a one-stop shop in terms of getting some of the services that they can benefit from. Aligned with MHA in particular, I know there's been a lot of interest and discussion in 988. Jennifer Piver with Mental Health America is on our steering committee. And so now we're about 2 weeks into that enterprise, roughly. If you're not familiar with 988, the short version of that is it was a federal mandate to have a single number for people who are in behavioral health crisis. That might be overdose, that might be suicidal ideation, those kinds of things. How many of you would say offhand, you know by heart the number to the sheriff's office? A couple. How many of you? A couple. No, I'm not going to ask why. No, I'm just kidding. Just kidding. But the reality is, how many of you know that if there was a crisis, you should dial 911? It's the exact same pattern. How many of you by heart know the number to Greater Greenville Mental Health or to the Carolina Center or to some of those others? Again, some definitely will, but if you ask the average person in the community, they don't. So when they have a loved one who is in crisis, 988 is a way of making that accessible. So they can call a single number that's easy to remember and from there navigate that. We're very fortunate and blessed that in Greenville County with Mental Health America, we have in-county support for that. That is where those calls are coming through. The problem is what we like to call affectionately an unfunded mandate. In other words, y'all have to do this, figure it out, God bless and Godspeed. So what we have seen in that 2-week time is a 40% increase in call volume. Since that's gone into effect, and talking to Jennifer yesterday, she said that they've had 7 people that had actively done harm to themselves that they've been able to get help and support from in that short window of time. The reason it is really important to us to keep that local isn't because we want to be just, yeah, that Greenville. The reality of why we want to do that is because how many of us know everybody in every organization in this room? I dare say that we don't. Likewise, what is the likelihood of somebody who was in Wisconsin getting a call from someone in crisis in Greenville, knowing where to make that referral? The likelihood would be really slim. So we really want to be a support to Mental Health America in that and help them get the funding that they need to be able to continue to meet that capacity so it's not outsourced. So that is part of one of the things I wanted to say about 988. Again, that's a major initiative we've been focused on as well. One other thing I'll mention is the Upstate Behavioral Health and Wellness Forum. That is a one-day training event that's going to be on November the 3rd. It's going to be held over at Prisma at the medical staff offices at the main campus. We've been working with Dr. Lommel there on that. That's going to be really engaged are intended to engage the community, to educate the community, and to equip providers to provide best evidence-based practice and care in multiple ways. The speaker lineup is phenomenal. I'm excited about it, and I'm looking forward to more information to come out in the days ahead on that. My contact information is here. I'm more than happy to be a support to any and all of you. Again, if you're not already a partner, it doesn't cost you anything fiscally to become a partner. It's literally just signing a commitment form, us coming alongside you, figuring out what services you provide so we can make appropriate referrals and providing those references to you as well. Again, thank you so much for your time. And without further ado, I will turn that back to Susan McClarty. Thank you so much.
Thank you, James. With what we found on the impact of mental health in our COVID listening sessions, we really appreciate you being here today and sharing a bit of that work. So thank you all for being present. We also have 18 with us over Zoom, and thank you to everyone for joining us in this work to ignite addressing homelessness here in Greenville County. And if you don't know me, I'm Susan McClarty, and I have the privilege of being the coordinator of the Greenville Homeless Alliance. I want to invite Tina, who was sitting right behind me, to come on up on stage. She is our lead volunteer for this Ignite event, and we are so thrilled that she's helping us. So please join me in a round for Tina. I was reminded this morning in my devotional of the importance of listening, and not just listening, but listening with the ear of the heart. The devotion reminded me that listening is an act of will. You will see the work of the Greenville Homeless Alliance is about listening. As you heard from Heather in the COVID-19 brief today, we listened to over 100 of you from working in different parts of our community. And it is through that listening that we aim to create community and political will to change those conditions holding homelessness in place. So doing that requires creating each of us working together for people seeking stability to exit homelessness. So I invite you to listen to 3 ways we're calling you to action. The first is art. Thank you to Triune Mercy Center. And on the back of your agenda, you'll see the opportunity to paint tiny homes. We have these great little tiny homes made in the USA. And we're gonna invite you to paint those. Also create a collaborative piece of art. You're welcome to do both. Paint as much as you wish, and all skill levels are welcome. We have Judy Verhoeven and Moody Black, who are both local artists, who will be in the art room to welcome you and encourage you in your painting and creativity. So these tiny homes will be part of our 2022 Ignite Luncheon. And for anyone that paints a home, we'll ask you just to share a few things when you leave your piece behind.
What does home mean to you? Or what brings or gives you hope? The process for these collaborative pieces of art is described on your flyer. And to those of you on Zoom, we will be sending all this out in our GHA update. We also are creating Facebook events. If you like Facebook and enjoy those reminders, once you say I'm interested, you can, follow those and use that to help you stay organized. And we hope that you will come and see Judy or Moody or both. So the second area is documentaries. And our highest priority for the Greenville Homeless Alliance this year has been to focus on this bottom part of the triangle, the systems change triangle that Heather also talked about. Because we have to change how people think and feel about homelessness here in Greenville County. So we are thrilled to announce that entire class of Bob Jones University's film department will be creating 1-minute documentaries. So some of you we've already reached out to who provide direct services, but if we haven't and you have a story and we have not contacted you, please contact me or feel free to contact Tina. And Jason, our intern at the back, has been doing a tremendous job of been connecting the details that will be given to the students as they come back to the campus this fall. Each story will also have a featured banner at the 2022 Ignite Luncheon, and the banners will travel after the luncheon to other locations in Greenville. So this is an opportunity for your organization to be featured both in November and in the months following. So our third, I go back to the Ignite. Our third ask today is just to consider financial support. The luncheon is our only fundraising event for the Greenville Homeless Alliance. We don't receive HUD funding, and so we rely on you, the community, to help make our work possible. So if you're interested in learning more about our sponsorships for the Ignite event, please feel free to contact me. When you do, you're helping support 2 people to wake up every day trying to coordinate over 120 partners that are in our work and over 1,500 individuals that, as you heard, we need to grow. So we change more hearts and minds. So in closing, I just want to thank you for listening and being present today. Please enjoy a popsicle when we wrap up here in a few minutes. Join us in the art room, share this opportunity with your network, send us a story, and consider how you or someone you know can be a sponsor at the Ignite Luncheon. Thank you.
Hey, everybody. Great turnout today. And I am between you and popsicles. So it was a dark and stormy night. My name is Bruce Forbes with Share and also a member of the CoC or Continuum of Care. Whether you realize it or not, you are also members of the CoC, Continuum of Care. It's basically anybody that really wants to help end and reduce homelessness in the Upstate. And it's a formal term that HUD has, but basically it is everybody in this room, you're a member of it. And if you want to learn more about how you can be even more involved with the Continuum of Care, give me a call, send me an email, reach out to United Housing Connections, our lead agency. But so I'm going to give you some announcements and information in terms of what we're doing from a Continuum of Care standpoint. And I appreciate what Lorraine already shared from the good work that's already being done. So regarding the point in time count, you may have heard about that. That's something that goes across the entire country the 3rd week of January. So we're already planning on doing that. Paulette Dunn with United Housing Connections, she just told me that she needs no help whatsoever and she's got it handled. So it's really easy for you all. But I think she might need some extra assistance. So it would be good to reach out to her or Brett Rawl at United Housing. And we're always needing volunteers. It's a great experience to meet folks who are literally homeless and learn a little bit more about what is going on in their lives, be able to make those referrals, et cetera, that can really help them. So be listening for opportunities to help out with a point in time count. and there'll be some planning meetings. What else? The NOFO, so the Notice of Funding Opportunity, essentially every year HUD provides us with about $3.4 million to serve about 18 projects in the upstate, with many of those projects here in Greenville. And these projects include permanent supportive housing, rapid rehousing. We serve subpopulations like mental health folks, domestic violence, HIV, chronically homeless, and families. So we haven't heard when the next one's coming out, probably in next month or so, and we'll have fun putting all that together. Regarding emergency solution grant monies, I can tell you that 13 organizations in the upstate received ESG dollars, and 5 of those organizations are here in Greenville County. So serving folks that way. What else did I want to say? Intern Jason, hey, it's Bruce here from Share. I will get you that family information that you need. So I'm looking forward to it, partnering with the folks at Bob Jones University. And then one more thing just to share with you too. When David was talking about, it took us a year in Greenville County to lease up 54 rental units with the emergency housing voucher, meaning I have money I want to give to you, landlord. But it took us a year in our community, and we're ranked in the top 5 or 10% across the country. So those 70,000, which is a puny amount for millions of people that need housing, are having difficulty getting leased up. What's going on? Really, I mean, what's happening in our community? It's not making any sense to me whatsoever. I appreciate the fact, and I hope that these landlord incentives that you've got going, David, are going to work. The pre-inspections, I think the vacancy losses, damage claims, all those things is kind of what's needed, I guess. And obviously a lot more units, you know. So, you know, we really need to do a little bit better as a community, as a country. Shouldn't have taken us a full year to lease up 54 units, guys. And I know you guys know this. Preach to the choir. Lori Rovin wanted to share something real quick about the period project.
Yes, so I just wanted to share, I'm the interim CEO of the Period Project. Can you hear me? So for those of you that receive our products, basically we provide a Ziploc bag of everything that a menstruator would need, all about dignity. So there's guys, you know, there's regular, there's day pads, there's overnight, there's tampons, there's heavy, there's light. We get wonderful volunteers to take bulk product that's donated and create what's called period packs. We have school packs, adult packs, and homeless packs. This is a homeless pack, and we put individual wipes in our adult packs. We used to put them in the school packs, but people were complaining the students would flush them down the toilets, and you know, they didn't have any fun. Well, we had generosity of many people donating while we asked for individual wipes. We're getting these great packs. And then we got from the TISA, which is a non-woven company here in Simpsonville, donated these great packs. And then there's a partnership with what's called Period Education Project. We're Period Project. We used to be Homeless Period Project. They create their positions here in town. They're on a mission to get accurate health information. And they do what's called pep rallies. And they created this card, so there's a menstrual health card in each pack. And a lot of people don't know about us, so I brought these cards. It's info at Period Project. For the homeless, we're putting them in these bags. We did not put our logo on them intentionally to, you know, it's all about dignity. It's a challenge because we're always thinking for money. Thank you, Jolly Foundation's been wonderful supportive of this project. But I brought cards, an easy way to go get a card, info@periodproject.org. And we have a portal system. We ask for basic information, sociodemographics, takes I don't know if anyone here is on this portal yet. We are now giving to share and start.
Okay, cool.
And that wasn't difficult, that was it? So there are a few shares that happen, but if your organization or your faith community has a food pantry or clothing closet and you need them, just reach out to us. We know 1 in 4 students or adult administrators miss school or work, and this is a barrier that we shouldn't have to deal with. And on the advocacy side, the Peer Touch will be leading with a new coalition called the South Carolina Menstrual Equity Coalition. And the first thing it's going to take on is eliminate the taxes, which has 6%. So thank you, Bruce.
Thanks, Lori. You're welcome.
So if there's anybody that can take them, you'll take them? Okay, so I have to.
So is John Martin here? Hey, John. I understand it's your birthday. Well, happy birthday. No, we're only celebrating John's birthday today. If everybody else has a birthday, I'm sorry. You'll have to come another day. Right. Is there anything else, Susan or Heather?
Popsicles at the back.
Popsicles in the back, networking. Keep doing great things that you're doing in our community. Thank you so much. Oh, super fast. Here it is, super fast.
At 2 o'clock, if you go to our website, walls.com, we're offering a free training by scientists on suicide awareness. It's only 1 hour. We call it lunch and learn. We put on free advocacy sessions like this for mental health. We did in September, mental health month at our school section. So if you just check us out, walls.com, I'll be posting that, but we're offering mental health first aid again, documentary program, bringing our educating mental health. So anyway, go off.
Thank you.
But this is a great thing for people to attend.
Yeah, absolutely. Thank you. John, you want to say a few things?
Yeah, just one thing. Radio 6:30 this morning. Now they got everybody. Everybody that leaves here today, go out and see one person that they come to fix. That would be my only wish.
All right, there you go. Thank you, everybody. Thanks, guys.
Yes.